I really, really love what I do. When I go to the communities, for example, I see how we really make improvements in healthcare. We support the community and they're very happy with us.
When we came in, you know, I knew where the issues were.
The worst is too congested. When people are poor, the state should be responsible for them.
We must make health a political issue.
A protest for the quick passage of the National Health Bill, a life-changing document which will serve as a legal framework for healthcare delivery in the country.
The health bill provides funding for the health system. The health bill provides funding for the National Primary Healthcare Development Agency to do their services. And what we did was to get 5,000 women, in fact, over 5,000 women. The media were there completely. And we went, we bombarded the National Assembly. We did not even know, even CNN and others carried it. For us, it was a major political point that we scored. The next day, the bill was passed. We worked very hard. One was a documentary to even let them see what the situation was. The late president, may his soul rest in peace, saw the documentary, and the former Minister for Health, Professor Sotimen, took it to him. He saw it and called for a national conference, at the end of which a declaration was signed to ensure that every state spend a minimum of 15% of their budget.
I think that one of the greatest challenges we still have in place is human resource. Health workers, health workers, health workers.
I know people that have gone to Saudi Arabia, the US, Australia, South Africa. I even have a friend in Equatorial Guinea.
That brain drain, because we are just working for the citizen of that country.
Why are these people not staying?
So we worked in collaboration with NYSC to get health workers, doctors, and sometimes midwives.
Village is a very interesting place. You know, with little impact, they appreciate a lot. They pray for you.
Har da gado za a je a kwantar da wannan. Akwai asibitin to amma gaskiya saboda sakaci na hukuma gaskiya ba a sami ci gaba irin wa'annan abu ba. Sai wannan lokacin ne aka samu wa'annan ci gaba tunda har akwai gado za a kwantar da su da waye ne kuma ga likita ko da washe.
Part 2 inaugurated a committee named World Health Committee.
To be like a committee that will be able to look into the affairs with respect to the health needs of those smaller communities.
This is the best place for them to go. For immunization, they will take care of the pregnancy.
I'm the one of the health, community health, yes. As a theologian, I used to tell all my people, even though you have pregnant, you are with a small, you should go there to go and register.
In the public sector in Nigeria, people pay. It's not free. People pay for their health.
Lokacin na ciki ya kama, center ne naje. An yi sai da dare karfe 7 shine an ture ni Sinagi.
One major thing in this part of the world is the cost. And that cost is what Part 2 had come in to step into.
You will pay, but they will help you to pay half of the money, depending on the charges of the doctor.
But if there is a public-private partnership, even without strong or very good support from the government, the health sector will still survive.
PATHS2, an emergency transport scheme, came into my life when I was First Lady here at the right time.
Sai jini ya barke mu. Jini yana ta zuba sosai. Aka kira unguwar zuwa ta tura ta iya sai ce to ai ga lambar wannan bawan Allah da ya bani a kira shi. Sai aka je aka kira shi ta waya. Ya zo ya moto ya dauke ni.
Komai dare komai rana ba a biyan su don ba mu taba ba su ko kobo ba.
Abin da ya kawo ni hawan jini na haɗe da shi kuma ya kai ni aka mun operation.
The wife of His Excellency, the Executive Governor of the Kaduna State Government, said, look, we appreciate what you are doing. And believe you me, they were strengthened.
In terms of, how can I put it? We need their help anyway. I don't know how to, because if I start mentioning it, I may have, don't let me go to that place for political reasons. So don't let me go there.
I discovered governance is a bit difficult. You have to look at your finances and now the demand. The demand is enormous.
Because if a former minister will come out to say the number of women that are dying is exaggerated, there are not too many. For heaven's sake, one life should not be lost.
Through the mega mobilization, we have a strategy called mobilizing the communities in a mega way.
Because it is mega, it means people can remember what it is. Oh, it happened at that event. So it's like educating the people about the services that the government is offering them. That's from the perspective of the people. Now, from the other perspective, the people cannot talk to the government and tell them, hey, you are doing this, but this is what we want. Okay? So it's like you're educating the people about what we are giving them, and the people are educating the government about what they need. So it's a two-way street.
So we even provide free health services in terms of screening and basic drugs for women and children. Why do we have a drug revolving fund? Because we know that if we just provide a street stock or some drugs for health facilities, it will be that when we leave, what will happen to those health facilities? Well, when you have a sustainable supply or a means of having a sustainable drug supply system, that changes everything.
When this scheme came up, it started with only 20 million turnover. Today, as at December 2013, we have over 700 million as a turnover. That is a huge improvement in terms of where we started.
Lessons learned for states to kind of replicate.
We here in Bauchi, those responsible for drug administration in the state, heard about the DMA in Kano. We copied the program and borrowed some of the copy of the law here to Bauchi, and then we initiated the process of legislation, and which culminated in the establishment of the Drug Management Agency here in Bauchi.
We have seen that the response rate is very, very high, because when they know that health services are there for them, we have the appropriate human resources that are friendly, we have the drugs available, the infrastructure looks good. Communities, I'm telling you, really respond to it.
I work in the grassroots. I see the pictures. It's not that we're not trying. The ministry is trying, the primary care agency is trying, we're all trying, but we could do more.